Cancer treatments are getting better and more patients are surviving their cancer diagnosis, but some people may have long-term physical pain, discomfort, or other side effects from treatment that can last well after their cancer battles. Some patients use physical rehabilitation to help, but not all patients have access to physio. A new study is looking at whether physiotherapy can help in all types of cancer. Joining us now is the study lead and physiotherapist, Denise Dreikluft. Good morning, Denise.
Good morning.
Thank you so much for joining us. So right now, when a patient has cancer, some will get physiotherapy. What would they be getting physiotherapy for?
Well, there are a lot of side effects that can happen from treatment, and cancer treatment is quite varied person to person, cancer type to cancer type. But we do know that fatigue is one of the major side effects for people that can be lasting years after completion of treatment. Some people can lose range of motion, strength, balance. They can have peripheral neuropathy, pain, changes to nervous system, function, quality of life. So there's a huge wide array of side effects that can occur from treatment. Right now, there is some limited access to physio. It's not a lot. There's lots of barriers to physio. There's not even a lot of services available.
Right.
So
it's not cheap either.
No, some people are fortunate to have insurance that can cover it, but not everybody has that luxury of having insurance, and otherwise it can be out of pocket. Like I said, there is some services, but I think right now it's just scratching the surface. There still remains a lot of unmet needs.
So people fight cancer, they're successful, they do really well, but they're not feeling great, and that is sort of placing a barrier on their ability to move on from that.
Yes, so oftentimes people struggle to get back to work, get back to school, get back to sports or other activities that they used to do prior to their cancer diagnosis and treatment. And it is an area that nobody really talks about a lot. People go through the treatment, and then the expectation is once they're done, they can just go back to life, but it's very often not that case. I just read an article this morning on Kate Middleton, who just released a statement yesterday saying after she's finished her treatment, she's struggling to get back to her normal level of function. And it is such a common struggle that people have.
Yeah.
And I think just the awareness is not there.
So your study, you started it just recently, and you are looking for people who are either just newly diagnosed or have recovered, and you want to find out how they're doing and what physiotherapy could do in their lives, right?
Correct. What we're trying to do is identify what unmet needs there are out there, and what barriers might be existing in preventing people from accessing physio, be it financial, be it awareness, lack of knowing that this is even an option, lack of services available. There's a huge list of barriers, and there's not been any studies done in Manitoba. So we're trying to get that information from this study.
So if you want to be part of this study, you can certainly find more information on our website. We have a link there. Thank you, Denise.
Thank you.